The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to the fourth and final of Child Care Aware of America's CCDBG Moving Forward webinar series. I'm Lynette Fraga, the Executive Director for Child Care Aware of America. Following on the first three of our webinars in this series, we have been discussing topics including what's in S1086, the Child Care Reauthorization Bill, currently pending in the Senate, and what it means for providers and families, and what impact it would have on components like the quality set-aside and quality rating and improvement systems. Today, we'll cover topics that we received a significant number of questions about, including funding, appropriations, and timelines for implementation. Today's webinar will be led by our Senior Government Affairs Advisor, Nick Busick. I wanted to note before we begin that I'd like to ensure if you have questions or comments throughout the webinar, please feel free to type them into the question box on your dashboard, and we'll set some time aside at the end of the webinar to answer as many as we are able to. Nick?
Hi, everyone. Before we get started into a little bit about the budget and appropriations and timelines pieces, I wanted to note that the CCDBG Moving Forward webinar series is designed to provide an introduction into the amended version of S1086, the Child Care and Development Block Grant Act of 2014, and what, if passed, those in the states will need to be made aware of. In addition to awaiting final passage of the bill by the Senate and the President's signature to become law, the Department of Health and Human Services will then be responsible for providing guidelines for implementation that could alter some of what's discussed during this series. In other words, we want to ensure that that it's clear that we're just simply using these to provide information, that some of what's in here is subject to change based on not only what happens in the Senate next week or the following weeks, but also what happens if the bill passes and is signed and enacted into law at the Department of Health and Human Services. One other quick note before we begin is that all PowerPoint slides, links to recorded webinars, and registration links will be made available shortly after the conclusion of the webinar at www.usa.childcareaware.org/webinars. We've already put up the slides and webinars from the first three webinars we've had on this, so there's also links to the YouTube videos. So if you haven't been able to see them or saw them and thought they were incredibly interesting, please feel free to share them and view them as many times as you like. And one last note before we get started is that Child Care Aware of America is unable to offer certificates for participation in this webinar series, even though we have in the past. And at this point, we'll turn it back over to Lynette.
So for those of you who may not be familiar, since 1987, Child Care Aware of America has been working to improve the system of early learning for children by providing training, resources, and best practices standards to local and state child care resource and referral agencies that support high-quality, accountable services. We also promote national policies and partnerships that facilitate universal access to high-quality child care, collect, analyze, and report current child care data and research, including child care supply and demand trends, and offer child care and parenting information and resources to families, and connect families to local child care resource and referral services. Before we begin, I'd like to just make a couple of comments about the child care landscape. As we consider the early learning landscape, you may hear about a patchwork of federal programs. However, in reality, there are only a few components to the core early learning system. They reach children and families in various places, at home or in organized programs. They meet various needs for families, child development plus parents' needs and families' needs, and at different times in the child's life. Home visiting and early Head Start can begin before birth. Home visiting and child care can last from birth to after school and after children begin school. So as we consider the state of child care currently in the United States, nearly 15 million children of working parents are in some type of child care. On average, they spend 36 hours a week in care, and at least 1 in 4 families, quote, piece together their children's care as they are placed in multiple arrangements. In fact, almost 60% of the cost of care is assumed by parents, spending more than 30% of their monthly budget on child care, more than rent, utilities, transportation, and food. So it's extremely important that we continue the dialogue, and we look forward to sharing additional information about the implications of the Child Care Development Block Grant reauthorization. Nick?
Thank you, Lynette. That was a great introduction into, a little bit about what we're talking about today. So what do we mean when we say the child care system? So out of those 15 million children that, have been looked at as needing care every week, we really look at what's called the Child Care and Development Block Grant Program, which is a federal grant program that provides child care assistance for families and also funds quality initiatives for child care. So it was originally signed into law in 1990, and then it was last reauthorized in 1996 as part of welfare reform. The main thing to know about CCDBG is that states have great latitude and flexibility in how they implement the policies. Under current law, CCDBG, what is commonly known as, does not require a background check for child care providers, does not require minimum training for providers either, or regular inspections, or very much any minimum protections for children. So a little bit more about the system. As I mentioned, it was established in 1990. Approximately 1.5 million children and over 900,000 families received child care assistance monthly in fiscal year 2012. In that same fiscal year, over 450,000 child care providers served children receiving these subsidies. As I mentioned, each of the 50 states, plus the District of Columbia and the Department of Defense, have their own unique systems. So states can use funding from a variety of sources to blend with CCDBG funds, including Race to the Top, Early Learning Challenge Grant funds, and Head Start funds. One thing to note is that some states have consolidated offices of early learning, while others use different agencies to administer funds and set licensing standards. And as I mentioned, states are provided with optimum flexibility to determine licensing standards for child care programs operating within their states. So what you see is very much a patchwork of what, states have may not look the same across state lines and rarely have very many things in common, which is important for some of what we're going to get into in a little bit. But before we get into a lot about what's in S1086 and how it will impact states, one thing we wanted to make sure we talked about, and something that's been of interest to many people recently, especially as this has come to light with the bill moving through Congress, is the budget and appropriations process and timeline. So there's two words on this slide that if you've been following Congress for the past few years, half of a decade, you probably haven't heard or seen much about, which is regular order. So typically the way the budget and appropriations process works is supposed to be a nice, straightforward process where in early February, the President submits a budget request to Congress saying this is how much we want for this program, this is how much we think you should spend on this program, maybe not that much on that program, and it lays out where the budget or the President's budget priorities are. In April, Congress is supposed to have completed action on a budget resolution, so basically an agreement that basically says the Senate believes this much, the House believes this much, this is where we both agree, and this is where we're going to move forward from. And from May to July, typically, the House begins consideration on what's called appropriations bills. So in Congress every year, they must agree to 12 appropriation bills that fund the government. These include the funding for agencies like the Department of Health and Human Services, the Department of Labor, the Department of Homeland Security, the Department of Defense, and so on. But they must pass all 12 of them at the end of each year to make sure that funding continues for the next year. And these bills must originate in the House of Representatives. So the House considers appropriations through that time, and around June 30th, the end of June, beginning of July, the completion by the House on these appropriation bills is the target date. So what happens after the House considers it in regular order? The Senate typically takes consideration from June to October of these appropriation bills and should have an agreement by the last day of the current fiscal year, which is September 30th, so that when the new fiscal year begins the next day on October 1st, they have agreements for all 12 spending bills, and the government keeps funded at whatever levels they decide. So that's regular order. That's the way it's supposed to work. It's a nice, straight forward process. Now let's talk a little bit about how it actually works. So the last few years, as many years prior to that, have been very interesting as far as budget and appropriations timeline goes in terms of the actual process occurring. So starting with September 30th, 2013, a little over a year ago, fiscal year 2013 ended. Well, what happened was Congress wasn't able to come to an agreement on appropriations bills. And from October 1st through October 16th, there was a little event I'm sure most of you have heard of called the government shutdown. This resulted because there were no funding for federal government because they didn't have the 12 appropriations bills. So until October 17th, when Congress was able to come to an agreement on what's called a continuing resolution, which funded the government at current levels through January. All this is a procedure they used to basically say, we can't come to an agreement, so more or less let's agree to disagree and keep funding the government at its current level until we can actually figure something out. So from October 17, 2013 until January 15, 2014, Congress worked on negotiating some kind of both a budget agreement, a budget resolution that set the guidelines and framework, and then the actual omnibus appropriations bills, which covers all of those 12 bills in one bill itself. On December 13th, Congress came together, first the House and Senate came together and passed a 2-year budget resolution for fiscal year 2014 and 2015. All this did was an agreement between Patty Murray in the Senate the omnibus bill. What about fiscal year 15, since we're coming up, only 6 months away at this point? What happened? Well, in March of 2014, the President submitted his fiscal year 2015 request. In April, the House passed the Paul Ryan, who's the Budget Chair Committee in the House, his fiscal year 15 request. And then from April through September, the House and Senate worked on appropriations bill. The Senate didn't submit a budget because they were going off of the budget agreed, the 2-year budget agreed upon. But as you saw with the House, they could have if they wanted to, but really didn't see the need for it since they already had a budget in place. So from April through September 30th, the House and Senate tried to work on agreements to find some common ground on appropriations bill. Since it wasn't looking like this was happening before Congress left town for recess for the midterm elections, they passed another continuing resolution for fiscal year 15, which would take them through December 12th. So the fiscal year 2015 began on October 1st of this year, just a little over a month ago, and that would take us through December 12th. So what's next? On December 12th, the continuing resolution expires. So Congress will need to either come to an agreement on an omnibus spending bill, which covers, once again, all of the appropriations bill, the 12 appropriations bill, which covers all federal government funding, or they'll have to come up with another continuing resolution, which will once again kind of push the funding question in conversation down the road until the new Congress. So it's really up in the air as far as what actually happens. So how does this all relate to the child care system? So the child care system is funded through multiple sources. It's all doled out in what's called the Child Care and Development Fund, which is administered by the Department of Health and Human Services. And it combines funding from the Child Care and Development Block Grant, the Child Care Entitlement to the States, which is the mandatory funding, and TANF transfers to CCDBG. So the combined CCDF funding streams are consolidated at the state level and administered under the rules of CCDBG. Last year, in fiscal year 2014, there were $2.36 billion in discretionary funding appropriated for CCDBG. Well, what's discretionary funding? Discretionary funding is funding that needs to be appropriated each year. So they have to sit down and agree on a number every year to make sure it's funded. And in 2014, it was there were $2.917 billion in mandatory child care funding. And the difference between mandatory and discretionary is, as I mentioned, discretionary is a yearly appropriation. They have to go through and figure out, how much they're spending each year. Whereas mandatory tends to be automatic and usually extended without having to decide on a number. So, a little bit about how does the discretionary piece actually, what's the language in that? When they pass bills, how did they talk about the Child Care and Development Block Grant Program? And the reason I wanted to highlight this is because it's a good way of showing something that will be very relevant in the next few slides. And that's, where does the funding go from here? What happens? So as you can see, this language in front of you is actually from the Consolidated Appropriations Act of 2014, which was the omnibus spending bill they passed in January. So in the massive bill that covered all federal spending, this was the chunk that talked specifically about CCDBG. So at the top, you can see it's payment to states for the Child Care and Development Block Grant, and the first bold section is, the total funding, the $2.36 billion should be used to supplement and not supplant state general revenue funds for child care assistance. Of that, over $19 million should be available for child care resource and referral services and school-age child care activities. And of that, approximately $1 million should be reserved for a competitive grant for a national toll-free referral line. In addition to those funds, about $300 million should be reserved to states for activities authorized under Section 658G, which are the quality improvement activities. So states must spend, some of that money, $300 million of that total $2.36 billion number must go for quality improvement activities. And of that, $100 million, so 1/3 of it, must be reserved for activities that seek to improve the quality of infant and toddler care. In addition to all of that, about $10 million must be used by the Secretary for child care research, demonstration, and evaluations activities. So they use it for a variety of different reasons, and you can see a little bit about how the money is broken down. So let's look a little bit about the history of child care funding. How did we get to that point? How does that number, how did we get there? What does that mean moving forward? And when we talk about it, what does that mean as far as what's possible moving forward? So a little bit about what the history of funding the system looks like. As I mentioned, it was originally funded in 1990, but reauthorized last in 1996. So first we'll look at the mandatory funding. So from 96 to 2002, there was a mandatory funding level that went from approximately $2 billion all the way up to about a little over $2.5 million, around $2.7 billion. And this was a funding set forth, and then it was extended through 2005 at a level of $2.717 billion. So from fiscal year 2002 to fiscal year 2005, although it didn't have to be appropriated, it was what's called extended, which just means it was authorized at that level since. So from 2005 on till about 2009, it was once again extended for a while to about from 2006 to 2010 at a level of $2.917 billion, which is the level it's currently at, because since 2010, it was once again extended through different bills and different means. So you see it kind of plateaued around that $2.917 billion number. Well, although we expect that to be, a pretty flat point, you look at what's happening with the discretionary funds, and you see a lot more movement. And the reason behind that is if you look at the years from fiscal year 1997 through 2002, you see that funding increase is a direct result of the authorization numbers provided in the reauthorization bill in 1996, which provided slight increases starting at 0.9 or a little under $1 billion, going all the way up in 2002 to a little over $2 billion. So what's important to note is that although this is the fund spent, the authorized levels were well below where this was at. in that time, it was actually authorized from 96 to 2002 at $1 billion per year. So what you can see is, although it started right around that 1 billion number, it went almost double. It went over double from that point forth. So what happened in 2002? Why do we see this great kind of lead up and then it completely plateau and even go down a little bit? So what happened in 2002 was authorization for the block grant program expired. And the appropriators got together and figured out this is something they wanted to keep funding, but it was difficult for them to fund it at a much higher level without authorization. So what they did was more or less flat fund it from 2002 each year until about 2008. So in 2008, what you see is from 2008 to 2009 and then back to 2010, there's a pretty significant surge. Now, some of you are thinking this looks interesting, and some of you probably know exactly what this is. In 2009, in addition to the appropriated funds for it, which were around $2.4 billion, what also happened was that the government provided, through what's called the American Reinvestment and Recovery Act, more commonly known as ARRA, provided an additional $2 billion of funding that was used for child care and development block grant funds to be doled out to the states. So what you see is this great bump, all above $4 billion in that year just in discretionary funding. Well, as you can see, it didn't last much longer after that. It was a one-time bump thanks to ARRA. And from fiscal year 2010 until fiscal year 2014, what you see is a slight raise going from about the $2.2 billion mark all the way up to about the $2.3 billion mark, which is where we have sat for 2014. For fiscal year 2014, it's been funded at $2.36 billion. And with fiscal year 2015 starting, that's the current level it's currently been appropriated for. So if you look at 14 and 15, that's where it currently sits right now. But moving forward from 2016 to 2020, what you see is this red line. Now, what is this red line and why is it important? These are the numbers that the S-1086 would authorize for the discretionary funding for the Child Care and Development Block Grant Act, or for the Child Care and Development Block Grant Program. So what you see is it raises it up in 2016 and goes beyond that to a little around 2.749, so about $2.75 billion in 2020, which again would have authorization expires. These numbers will provide the baseline of where appropriators can go when they're putting forward their appropriations bills. So just as happened in 97 through 2002, although those numbers are what would be authorized, it could very well go beyond that, depending on the climate and depending on funds available. But I want to call attention to this because at worst, if the bill is passed, these are the lowest figures they could go in appropriation. So at least we know that if it does pass, there is some bottom line movement towards increasing the cost that's going to it. So what's happening right now? And what is out there that have provided some insight into what we could be looking at funding-wise? So currently the continuing resolution that passed included the $2.36 billion for discretionary funds, which is flat funding from 2014, and $2.917 billion in mandatory funding, which once again is flat funding from the year before. So in the President's budget request, which I mentioned during the jarbled actual budget and appropriations timeline, he requested $2.417 billion in discretionary funds and a significant raise in mandatory money of about $750 million to take it up to $3.667 billion. So that's a pretty significant increase. When the Senate appropriators earlier this year, the Subcommittee on Labor, Health, and Human Services put out their bill for what the agency and appropriation should be. They put a discretionary amount of $2.458 billion, so almost $2.5 billion in discretionary funding, which is as you can tell, significantly higher than even the President's budget request and especially what is currently being funded at. So in that, what were the reservations set aside for the different pieces? So you see about $20 million set aside for the child care resource and referral and school age care activities. Of that, about $1 million for the toll-free hotline and website. Another reservation was over $300 million for the quality improvement activities, with over $1 million of that targeted for the infants and toddlers. About $10 million going once again for research, demonstration, and evaluation. So what this brings us to is the next part, which is talking about, okay, so that's the funding element of it. What's actually in the bill and what's happening on it? Why does the funding matter if the rest of it doesn't happen? Which is why we want to talk about a little bit about what the bill is and what's happened to it to date and what its current status is. So S1086 is the Child Care and Development Block Grant Act of 2013, now known as the Child Care and Development Block Grant Act of 2014, and I'll get to that in a second. It was introduced on June 3rd of 2013, and it was originally sponsored by Senator Barbara Mikulski, a Democrat from Maryland, Senator Richard Burr, a Republican from North Carolina, Senator Tom Harkin, a Democrat from Iowa, and Senator Lamar Alexander, a Republican from Tennessee. Before I talk a little bit about what's in the bill, what I want to mention is that if you look at these four names, and you don't have to know much about Congress to know that anytime you can bring four senators from so different states as well as different parties together to agree on a bill and sponsor it, it's a pretty significant statement. So what's actually in it? And I do want to note this is what's in the amended version of S1086, and I'll talk about what happened, how and why it was amended in just a moment. But under the amended version of S1086, which was just recently passed by the House of Representatives, states would be required to conduct comprehensive background checks, would be required to inspect programs prior to licensing, they'd be required to conduct an annual announced inspection of licensed programs, and an annual announced fire, health, and safety inspection of license-exempt providers receiving funds. They'd also be required to implement professional development and training standards as part of their licensing. It would raise the amount of funds set aside for quality improvement activities, which we actually talked significantly about in our last webinar. It would raise the eligibility period up to 12 months. And it would also designate a national toll-free hotline and website for referrals, quality information, and consumer complaints. So how did we get to this point? And a little bit about, before we go into that, I'm going to stop and talk a little bit about, all right, so we've talked about all of the funding that's happened to date, what the funding could be. Well, what is the cost of the bill? Has anybody done estimates on it? And I really wanted to highlight that something that has happened, and the only estimate out there that has provided any insight, just to provide some general guidelines. If we are hearing that some of you may be having some technical difficulties listening in, if you have lost sound or see the slides moving and we do lose sound, please just type it in the box and we'll try and let you know. And we'll see what we can do. So a little bit about the Congressional Budget Office score of S1086. The original score, so every time a bill comes out, Congress can request what's called a score, which is a cost estimate of a bill. And in March, when the bill was originally going through the Senate, the original introduced bill, the Congressional Budget Office scored or estimated what the bill would have cost to implement and what the different pieces of the bill cost to implement. The estimate that they provided was based on the bill as of February 2014. And as I'll talk about in a few seconds, the bill was not only amended through the passage of the Senate, they also amended it once again when the House and Senate came to an agreement in September. So this score does not currently reflect what exactly the cost would be and what it would cost to implement. So I do want to make it very clear, this was just the estimate that they gave at the time, but it does provide some insight into where the CBO believes the cost would be for each component. So they assumed enactment in fiscal year 2014, which is actually, as we talked about earlier, not going to happen as fiscal year 2014 ended on October 1st of this year. So it estimated a total cost of $13.1 billion for the CCDBG program, including implementation over fiscal years 2015 to 2019. So they assumed it would cost about $13.1 billion, including the appropriated funds, to actually implement this fully. So what were some of the costs of the different components of the bill that they felt were necessary to call out? So for the 12-month redetermination period, so making sure that continuity of care was at $175 million a year, the cost was approximately $175 million a year and $800 million total over that entire section. For inspecting license-exempt providers at the fire, health, and safety inspection, it was approximately $35 million a year over that time, which made up about $150 million total. So in the original bill, the quality set-aside would have raised it until 13% total, whereas the amended version, one thing to note, is it would have put it to 12% total. So you'll see a little bit of room with this is it estimated it at the 13% total at $25 million a year, or about $100 million total. For the health and safety requirements, so putting in some health and safety requirements, it said it would cost about $20 million a year, up to $100 million total. On the consumer education piece, putting in all the components and requirements that happen, it would look at about $10 million a year, and a total of $50 million total. And lastly, the background check piece, they estimated would cost $1 million a year with $5 million total. So as I said, these are just estimates provided by the Congressional Budget Office to provide some background as to where the discussion should really start around what is this actually going to take or cost to implement it if it does pass Congress and is signed by the President. Which brings us to our next step. What's actually happening in this? What's happened to this point? How has it gone through Congress? And what is going on? As I mentioned, it was introduced June 3rd of last year by the Senate, by the leaders of the Senate Health Committee, the Health, Education, Labor, and Pensions Committee. A few months later, it was reported out of committee, which means in September, the Senate Health Committee had what was called a voice vote, where they basically gave a yay or nay vote around whether or not they thought this bill should go through and move on to the full Senate. And all of the senators present in the committee voted affirmatively. They thought it was great. There weren't much controversy around it. And at that point, it moved to the Senate floor. So in March of 2014, the Senate took up debate on March 12th. And on March 13th, after adopting 18 different amendments, voted to pass it by a vote of 96-2, which is a pretty significant vote, especially in any recent Congress. So it went back to the House. In March, the House held a hearing on CCDBGs, tried to figure out where they wanted to go, if there was something they felt they could do to improve upon the bill, or if they liked the bill as is, and tried to figure out really what's happening. So on September 12th, the House and Senate leaders agreed to an amended version of S-1086, including some new pieces, as well as revising some of the pieces that were included. And only 3 days later, on Monday, the House passed that new bill with all those changes by voice vote, meaning they said, once again, we all like this, let's send it back to the Senate for final approval. Although the Senate had considered putting it through the unanimous consent process that week, they were unable to do that, which means that it was once again put on the Senate calendar for when they resume business, which is actually a week from today, November 13th. It's one of the top legislative items in the pending business. So when Congress comes back, there's a cloture vote scheduled, meaning they'll move, if that vote passes, to actually consider the bill after approximately 30 hours of debate. So what happens if the Senate approves the amended version? It would go on to the President, which would then have about 10 days or so to decide whether or not he wants to sign the bill. And if he signs the bill, it would be enacted. And if he doesn't, as long as he doesn't veto the bill, it would move forward to to going forward with it. So what happens generally? So I talked about how did we get to this point. Real quickly, what happens next is, so first Congress would have to pass it. So the Senate, it's already been through the Senate. It went to the House. It just needs to go back to the Senate for final approval, and it would move on to the President. The President would then either sign it or veto it. If the President signs it, the bill would then become law. So what happens after a bill becomes law? Is it automatic? Are states automatically expected to comply with that? How do states know what's happening? The bill actually goes from the White House, it becomes law, and it's sent to the relevant agency, which would then become responsible for implementing that bill. So if a bill is focusing on defense or the military, it would go to the Department of Defense to implement that bill. In this case, if the bill is passed, it would go to the Department of Health and Human Services, which would be the relevant agency who already administers the program, and they would have to come out with guidelines for implementing the bill. And we talked about this in my note in the beginning, but this is a place where, depending on the Department of Health and Human Services and their interpretation of the bill, now law, they could alter it or provide some pieces which are different than what we see in there, although they couldn't change anything specifically in the bill. Once the Department of Health and Human Services puts forward their guidelines for implementation, their guidance for implementation, it would then go down to the states to start implementing with the assistance of the Department of Health and Human Services. So, what's next? So we talked a lot about, this is the process, how does this happen? But what we really want to talk about to finish off this webinar today is what happens if the Senate passes S-1086 and the President signs the bill into law. So with that in mind, in S-1086, there are certain dates set forth that if enactment does happen, so if the Senate passes it and the bill signs and the President signs the bill into law, by, say, for the purpose of this, and this is not by any means an endorsement or a guarantee that this happens, this is just for the purpose of setting forth an estimate to provide some general timeline. If the bill were to be enacted in December of 2014, what we see are some important implementation dates starting in fiscal year 2016. So, like I said, these are just the estimates based off of a date that we're using to put forward as a guideline for this, although I want to be very clear that these dates could change, and these are all contingent on the bill passing the Senate and the President signing it into law. So, what are some of the pieces to know? First off, as I mentioned, funding would be authorized around $2.5 billion for fiscal year 2016. State plans would be due for 2016, and it would mean that state plans would now have to cover 3 years as opposed to the 2 previously. In those state plans, they must include a certification of compliance or movement towards compliance with licensing requirements and how they're enforced, including but not limited to training requirements, consumer education requirements, technical assistance, child-to-staff ratios, and basic health and safety requirements. Once again, these are stuff that could be interpreted differently by the Department of Health and Human Services. They will provide guidance around what does it mean and how does it look. What are some other dates or pieces that must be included by the start of fiscal year 2016? This is the first year we see that the quality set aside, so the funds reserved for quality improvement activities, must be moved up to 7%. Under current law, as we talked about last webinar, it is currently set at 4%. So by 2016, the start of the fiscal year, all states must start spending funds for that year at 7% of the total. So additionally, all states must also describe and provide assurance or certification how they're complying with those funds being set aside, and they must also provide a description of how the funds were used in the state for the preceding fiscal year in an annual report containing the amount of funds reserved, what activities they did, and how do they evaluate, or what measures or methodology do they use in evaluating the outcomes of whether or not those dollars that were being spent on quality actually move the bar on improving quality. And additionally, not later than July 31st, 2016, and every 2 years after, HHS, the Department of Health and Human Services, would be required to provide a summary and analysis of aggregated data on families and the subsidy program to Congress to show how this is actually working. So what are some other dates in it? So 1 year from the date of enactment. And as I said, assumed in this case only means for the purpose of this webinar. We make no assumptions about whether or not the bill will be passed and signed into law. But 1 year from enactment, HHS must provide to Congress an interdepartmental review of all early learning and care programs for children less than 6 years of age. So HHS would have to put together a report on, well, how are these programs interacting with each other? How are they serving kids differently? How are they working together? So what happens at the start of the second full fiscal year? States, at the start of the second full fiscal year, states must ensure that, once again, they're at that 7% level for the quality set-aside. So 2 years from enactment, there are some more pieces in place that states are going to have to be required to comply with. So 2 years after the date of enactment, states must provide certification that they have policies in place for licensing inspectors that are qualified to inspect providers and have received health and safety training, pre-licensing inspections, and annual inspections, and they must maintain a sufficient ratio between inspectors and programs. So in other words, maintain a way of fixing caseload for inspectors, and additionally, an annual fire, health, and safety inspection of license-exempt providers. So 2 years from the date of enactment. So whenever enactment happens, whenever the President signs the bill and turns it into law and sends it to the Department of Health and Human Services, 2 years from that date, states must ensure they have policies in place to cover the inspection piece of the bill. Additionally, 2 years from the date of enactment, HHS is required to provide a report to Congress on the studies that they partook on waiting lists to determine the number of families that are eligible, that have applied for assistance, and have been placed on a waiting list for that assistance. So, what happens prior to the end of that second full fiscal year? So what has to happen prior to September 30th of 2027 if this is passed and signed from bill into law? States must ensure that an additional 3% of funds are reserved for quality improvement activities targeted specifically for infants and toddlers. So I talked about the 7% of funds that has to be started, but in addition to that, an additional 3% must be targeted specifically for infant and toddler quality improvement activities. So total, the aggregate number would be closer to 10% of funds. Additionally, by the end of the second full fiscal year, states must ensure compliance with comprehensive background checks, which was a major component of S1086. Additionally, if the state is showing good faith in implementing this part, HHS has the flexibility in the bill to allow an extension with the waiver as long as they believe the states are acting in good faith towards implementing this piece. So what happens 3 years from the date of enactment? Once again, this is just whenever the bill of enactment is. As I said, we assume the date for the purpose of this webinar and for the purpose of providing some general timeline. 1 year after coming into compliance with the inspection piece of it, but no later than 3 years. So by the third year of enactment, states must have the inspection reports posted publicly online. So if your state comes into compliance 2 years with the inspection piece of it, 1 year from that date, they must make sure that they're posting the inspection reports online in an easy-to-access way for public consumption. So fiscal year 2018, what happens? Where do they start seeing the funds set at? The funding authorized for that year is $2.6 billion, and states must ensure at this point it goes up an additional quality percentage to 8% for quality set-aside dollars. And lastly, what happens for the remaining few years? So you see, once again, the authorization level goes up to $2.668 billion for fiscal year 2019, and it plateaus for that year at 8% for quality expenditures. And at this point, so that 8% is just for all quality improvement activities. There's still the additional 3% for every year after that second full fiscal year that they must be doing in addition to that, whatever the total number is. So for fiscal year 2020, it's set at $2.749 billion, so almost $207,050,000 for fiscal year 2020, and it must ensure that states are spending 9% of all total expenditures for child care, must make sure that 9% of that is going towards quality improvement activities, and states are doing an additional 3% for infant and toddler quality improvement activities. So September 30th, 2020, if passed and if enacted, it would mean that on September 30th, 2020, authorization of CCDBG would expire, meaning that funding would once again either have to be reauthorized or it would have to be appropriated in a manner similar to how it was from fiscal year 2002 to fiscal year 2014 and 15 now. So I understand that was a lot of information around what's going on with the funding piece, what the timeline could look like. I really want to emphasize that it's really what it could look like. It's not a guarantee that these are the dates that happen. These are what's publicly set forward in the bill as the dates that they expect it to be. The interpretation of HHS, if passed and signed into law, could provide some flexibility or some alterations. But at this point, we want to open it up for some questions. We have about 7 to 8 minutes or so, and we already have a lot of good questions coming in. And we really want to make sure that we're getting to your questions. As I mentioned, this is the last of our webinar series, and we definitely appreciate your participation in any or all of the webinars. But if we don't get to one of your questions, please feel free to contact us, and we'll provide our contact information as well as where you can find all of the information, the slides, and the webinars at the conclusion of this. So at this point, let's go into some of our questions. And like I said, we have a lot, but if we're not answering your question, please feel free to put it in the box and just let us know. This is a great question and something that's very important, which is why I'm going to answer first. What happens if S-1086 is not passed by the Senate November 13th? I'm actually going to expand upon that question a little bit and talk about, okay, so if the Senate comes back and doesn't pass it right away, what happens? The Senate has until approximately January 2nd of 2015 to pass this bill and send it to the President's desk. When Congress expires, the end of this session, the 113th session of Congress expires on January 22nd, all bills that are still pending will no longer be pending and they'll be considered not passed and won't go to the President's desk. So as long as this passes the Senate prior to that date, it will go to the President's desk. So if it doesn't pass specifically on November 13th, it could pass the following week, or it could pass any session of Congress until they come back, until they hit that January 2nd deadline. As many of you probably guessed, Congress doesn't work that entire time, although they will be back in session to figure out things like the appropriations bills and the budget. So this is another great related question. What happens if the President doesn't sign the bill? So there's a few options of what could happen. The President has 3 choices. He can sign the bill, he can veto the bill, or he can just not do anything. So if the President signs the bill, it's enacted into law. If the President vetoes the bill, it goes back to Congress, at which point, if Congress has the support, they could do what's called a veto overcoming vote, at which point they would need a veto-proof majority, so 2/3 of the Senate would need to vote affirmatively to override the veto of the President. If that happens, it's enacted into law. If the President doesn't sign the bill, what happens is automatically after 10 days, it instantly becomes law. So what does it look like? The President has been in great support of child care, especially improving the quality, and our assumption, and I will say assumption, is that we would be very surprised if the President and his administration are not in favor of this bill. So we are not, currently expecting too much of an issue with regards to the administration? Thank you for those questions. Those are great things that definitely needed covered before we kind of move forward. So this is another great question talking about what happens when HHS gets the bill. Who can influence how HHS interprets the provisions of the bill if signed into law? So a little bit about what happens at HHS if the bill does become law. So once HHS gets responsibility for the law, what would happen is they would have to sit through and release what's called a notice of proposed rulemaking. And if you follow child care closely, the Department of Health and Human Services did something similar to this in May of 2013, where they provided some regulatory changes to the Child Care Development Fund. Although they would have to rewrite new guidance for that when it comes out, in that process they'd have to release a new notice of proposed rulemaking, which could be opened up for public comment, just as the original one was in May. So this is the chance where anybody could make a public comment and say, this is how we feel about this piece, or this is how we feel about that piece, influencing how they go about interpreting it. That would be the best chance for the majority of people to have influence on it. Also, additionally, throughout the process, HHS holds what's called stakeholder meetings, where they meet with groups like state administrators, or they meet with advocates, or they meet with people in the states, or they meet with tribes and Indian reservations and talk about, how they implement it differently, or what interpretations they need to be doing. So it's all kind of, it's all kind of a process contingent on where they really do see their interpretation coming and how much public participation they really feel like they need. Well, this is a great question. How does this week's elections results affect the lame duck session and political will and ease for the bill to get through next week? So I really don't want to cover too much about the politics influencing it, but I think it's a great question and something that I'm sure a lot of people are probably wondering about, especially since you see that, there's going to be a change in Congress next year. Our next session is going to be an all-Republican Congress. What it looks like is that it really will be up to the Senate to decide how they go forward and how they go forward from here. And it will be up to both the current Senate Majority Leader, Senator Reid, and the current Senate Minority Leader, Mitch McConnell, who will most likely be becoming the Senate Majority Leader, how to proceed with what's going on in the lame duck session. So there's been a lot of talk primarily around the appropriations process and what impact that may have as part of that. But as far as our bill is concerned, or as far as S1086, the bill that we've been talking about, is concerned, it really has yet to see that there may or may not be impact on it yet, and we won't really know that until they get back into session next week. So this is another great question. So, I talked a little bit about the comment process. It says, will Child Care of America be providing guidance to R&Rs as well as others across the states to help them in forming responses, comments during the public comment period? So let me talk a little bit about what happened last time when HHS put out the comment period beforehand and what we're looking at doing this time. So when the Department of Health and Human Services put out a comment period for the initial notice of proposed rulemaking, Child Care Aware of America hosted a series of webinars, as well as provided templates to R&Rs and provided our own letter of public comment that was submitted to all R&Rs to see not only what we submitted as a national organization, but providing some guidance around, well, what might CCNRs be interested in. We understand that the timing was short, so we wanted to make sure we provided some technical assistance to R&Rs to help them get through the process of doing their own. I'd assume that depending on the timeline of what HHS may be looking at, whether or not the public comment period is opened or how long it opened, will probably change how much we're able to provide as far as outward support to the R&Rs and the field at large. So I hope that helps answer that question a little bit. But let's see some of the other questions. We've got a lot of great questions, so I want to make sure I get to some of them that kind of touch upon the same pieces. So let's see. Oh, this is a great one. Are child staff ratios specified in the bill for family, child care, and center care? So, no, the quick answer is no. The bill does not specify a number or a ratio. But what it does specify for the first time in federal requirements is that states must set a ratio. So it at least mentioned that states have to be paying attention to it, and it's something that, as part of their compliance, states are going to have to set some kind of guideline, even though it doesn't mention a specific ratio or not. So I hope that helps answer it. So let's see, we have time for one last question, and I think this is a good one, and something we'll cover in a few seconds, but it doesn't hurt to mention it. All of the slides for our previous 4 webinars, as well as the slides for this webinar, and all the recordings, the links, will be available via YouTube and on our usa.childcareware.org/webinars page. And once again, we would like to take this time to thank you for your participation in not only this webinar and all of the past 4 webinars. We hope that if you have questions that weren't answered, or if you think of questions as you're going through this, or know people who have questions, please feel free to direct them to us or to our webinars, our resources. You can find the link here. Additionally, if you have additional questions or are looking for assistance, please feel free to reach out to either myself, which can be found at nick.vusic@usa.childcareware.org, or to reach out to our Director of Policy, Michelle McCready, at her address listed there as well. We hope you have a great rest of your Thursday, and we hope to work with you guys in the next upcoming weeks. We're going to be putting out a lot of information regarding the actual activity happening in the Senate. So if you are interested or can advocate, we hopefully will be hearing a lot from us around what you guys can do to make sure this all becomes a reality in the next few weeks and months.